here's the things that we want to make sure that we take care of while we're together. Uh, why do we assess students? And this is something that takes up a lot of our time. There's a lot of paperwork involved, and why the heck do we even engage in this activity? So I think it's really important to delineate those reasons, because I believe some of those reasons are more important than others. And so we get our hierarchy of initiatives in place. What we're going to do is review some selected rules and regulations. This may feel a little dry, but there are some important things in this Vermont regs which mirror the federal regs that have to do with evaluations and comprehensive reevaluations that indicate what we must do, and it suggests that everyone's entitled to a certain level of evaluation. But at the same time, there are sections that tell us that we can be fairly creative in how we do this, and that's what opens the door to what we're going to be talking about during this session. How do we evaluate kids or students who look like they might be really tough to evaluate? We're just going to chat about who we're talking about, and just to kind of, as a spoiler, when we started talking about today's workshop series, we were thinking mostly about low incidence populations, students that attend our schools. But as the more I thought about it, the stuff we're going to talk about today, the concepts, given the changes that are coming down the road in special education eligibility, a lot of what we're going to talk about applies to the most commonly referred evaluation case, and that's learning disabilities, and then within learning disabilities, reading. So we're going to make that connection along the way too. For you folks who have on your caseload a broad range of students, you're going to find that many of the things we talk about are going to be applicable as your district moves away from a certain model of identifying kids or students who are eligible to a more, we'll say, progressive model. We're going to talk about what is it we're assessing. The federal regs lay out a range of things that says we need to consider. It doesn't necessarily mean we need to assess each one, but we're going to look at what are the things that we need to consider. And then if we have concerns in those areas, that's what directs our assessment activities. We're going to look at some broad assessment tools. What are kind of the tools that are out there? We're going to look at achievement tests, cognitive tests, adaptive behavior, just in the broad sense. What are they and what do they measure? And then we're going to get into the evaluation plan teaming meeting. One of the things that, as a psychologist, this is one of the important, or contracted person or anyone conducting the evaluation, this is the most important meeting because it lets us know what are the questions that are being answered. And then I, or whoever is doing the evaluation, has a responsibility to answer those questions. So the answers you get are only going to be as good as the questions you ask. And so we're going to take a peek at how do we provide guidance to our evaluators or people who are conducting evaluations so that we get the results that we're looking for. Now, don't panic on this, but we're going to look at some basic psychometric concepts there. I'm going to do it in a way that's kind and supportive, but there are certain things that we need to know as members of educational planning teams, and so that we can make decisions about our students and the veracity of the data that we're getting. So we're just going to review some of those. There won't be any quizzes or anything, but just kind of bring things to your along the way, we're going to talk about common pitfalls of situations. I've put a number in there that I have observed in working with teams over the years, and also which came up when working with the I-Team folks during our planning for this. So here we'll kind of put those out that are commonly, might be commonly occurring for your teams. We're going to look at scores and what they mean. This is really important because there's much more to these numbers than meets the eyes. And so again, I'm going to try to be kind as I review these scores, because some of them are not appropriate for use with the population that we're talking about here, low incidence populations. And I'll explain and give you some visual representations of why that's true. Because that will allow you to then guide the people doing the evaluation to say, no, we're not really interested in that score and that score. Here's what we're looking for. Okay. Again, we're going to review the types of assessments that are out there, and then the big part we're going to look at is the cross-battery assessment process. And that might be a new term or might be an old term for folks if you've heard it, but it's a it's a process I've been using for my entire career, because we're going to find that that the business of publishing tests is no different from any other business. So at the risk of sharing too much, I have very large feet. And when I go in to buy a pair of shoes, I look at these nice shoes on the shelf and I say, can I get a pair of those? And they they measure my foot and say, well, they don't come in that size. You can't. So I either end up with these plain loafers, because they just don't make them for people with big feet like mine. Or worse, the salesperson comes out with a pair of size 12s and says, why don't you try these? Why the heck would I try to pair your shoes on that I know are not going to fit? Well, the same is true with the testing, is that the test publishers do not create or publish a lot of tests or for low incidence populations, because the market is not there. It's just business. But we don't want to make the salesman's approach. We don't want to use these tests in the inappropriate way and apply it and I've seen it when I do record reviews, where some evaluators will use a test that's inappropriate for the individual and then report the results, and those results are perceived or believed to be accurate representations when they're not. So what we're going to do is look at a variety of tests, and I picked the most common ones, but I'm going to encourage you folks in the most notes or minutes, if you have certain tests that you're wondering about and what you're not clear of what they test and how they test them, put them in the chat box. And what I'll be doing during our second session is we'll be looking at these tests and analyzing what are the requirements. Is this someone who is deaf or hard of hearing? Could they participate in this? And if not, is there a way to accommodate it so that they would? And we'll talk about how do we accommodate these tests without changing what they're measuring. And then anyway, we'll look at a variety of tests and see what and see if we can develop some profiles from these tests of pieces of them that we can use. So that's what the cross-battery approach is finding out, are there elements of variety of tests that are appropriate for the student in question that can answer the questions that are developed by the educational planning team. We're going to be talking about reporting out. Boy, think about, this is really where we need to have our perspective taking. I've been in meetings where there's social services are in the meeting. You got the building principal, you got the special ed director, you got the special educator, you've got a host of professionals, and you got mom sitting at the end of the table. This is a very intimidating and scary, can be a very intimidating unless we turn it into a welcoming. And so I want to talk about how do we report out information in a way that is comfortable and so parents can understand it, and other lay folks who might be there. And again, lastly, the last couple of things is, as I said, specific test analysis. We're going to look at tests and say, okay, what's the test? What does it, and is it something that we can use with certain populations? The number one that always comes up is, required to determine initial or continued eligibility for services. And so, when we all know that if anyone has a concern about a person's suspects a person might be affected by a disability, they can request an evaluation, and within 60 days, in most cases, we're required to do that. So this is in fact someone who has a disability. And then secondly, okay, now that you have a disability, we're entitled to services, but we got to check every 3 years. So there we go. Continue to be in compliance. That's right. We got to do the right thing, or we get in trouble if we don't follow the rules. And so we're going to look at a little of those rules to identify potential strengths and challenges. So some of these are things we must do. Some of the ones that I think are higher order, more desirable things, and this is one of them. Yes, if we can identify youngsters' strengths, we can use some of those strengths to ameliorate or deal with the challenges, for sure. And you folks came up with all of these to inform instruction and program development. Exactly. It's okay. What do we need to do? One of the ones that I don't have here that you folks have, which is an excellent one that I'm going to add, is to gain baseline data. You can't know how far you've come if you don't know where you started. So that's an excellent one that, okay, here's the youngster's status on this particular skill. 3 years later, what's that status? And so The other piece is to inform IEP development. Exactly. That's one of the main purposes of evaluation is all assessment data should inform instruction, which in fact, if you're eligible for special ed, is then guided by the IEP. Gather information related to enabling involvement in practice within the general ed curriculum. That's one of the things that's in the regulations, and it's something that we sometimes overlook. But yeah, did we find stuff out through this evaluation, or is there something that we need to look at that will enable greater access to the general ed curriculum? To document growth. So, okay, this is similar to the baseline. That's if we've had baseline data 3 years later, what's that growth looking? And then lastly, accountability. If 3 years have gone by and we haven't seen any notable growth in an individual, we got to start thinking, what's going on here? We got to get something going. I'm sure that's rarely the case, but that's one of the issues that arises. So we already have a big check mark for how well you folks recognize why we do this. And I encouraged by the fact that the overwhelming majority, we recognize we got to do it, that's regs, but then there are these other pieces that the reasons we do it is to increase better outcomes for students. That's what all the other ones. So, all right. One of the things I want to point out in the jumping right into the regs, and this is one of the things that came out through our discussion with the I-team folks, and also that I've observed quite a bit. And it's this piece right here that if it talks about reevaluation, it says we need to do it every 3 years. But then it has this clause down here. It shall occur at least once every 3 years unless the parent and the LEA agree that reevaluation is unnecessary. And my personal perspective is I can't think of a time when it would not be necessary. 3 years have gone by. How are we going to do all those other more reasonable things? Remember, we said, sure, we got to do this reevaluation because it's the law. But then we had all the other things that I believe are more important than being in compliance with the law, informing the IEP, documenting growth and all that. And so in the absence of a comprehensive reevaluation, we don't have that data. And so I think that at every turn, the impetus should be, yes, we are going to conduct as comprehensive a reevaluation as we can, given the circumstances. That's a personal bias. I believe that all students, regardless of their impairments, are entitled to that close look every 3 years. One of the things that frequently comes up is that people suggest that certain things don't change; they become stable over time and all that. And then I would suggest everything changes over 3 years. So, for example, even if our brains are changing every minute, that was right now your brain is changing. You're developing new synapses because you're listening to this, and you're pruning old ones you haven't used. The same thing's going on with every one of our students. Our students are being exposed to instruction over 3 years. There are changes occurring within their basic skills or within any skill that you're teaching them. And we need to attend to all those other positive reasons for doing reevaluations to get that data. Okay. So again, that's a personal bias, but the regulations clearly tell us that if we don't have to do it, I would suggest that I believe it's essential that we do, in spite of the fact that we're allowed not to. Okay. I think we mentioned that Mary Ellen's watching the chat, so if I don't have the chat box up going, but I think she's going to let me know if someone has a question that really is important to answer, or feel free to disagree and throw something and put something in there as well. I like to try to make it as interactive as possible, but it's a little tough. Okay. So let's just talk about who conducts it. And again, this is a refresher for many of you, but let's not forget all the important people we need to involve. You got to have an LEA rep. LEA is their local agency. And the reason is because you can't do anything unless you might have to spend a little money as a result of some of these things. And many districts do not expend money unless it's approved by an LEA representative. So you have someone there. But the team might decide, well, we want to hire Elwood Pratt to do the evaluation, and we know he charges a little more than other people. He really knows a lot about persons who are affected by autism and and that has to get the wink and the nod from someone. So got to have a general ed teacher for sure. That's the whole purpose of special ed, is to allow kids access to general ed. So we have to know, what do we allow them to access? We need to have their input. And what are some of the things that the general education folks want to know about this youngster that will enable them to provide support and services and instruction within the classroom. Anyone else who the parents feel would be helpful? It could be a friend or neighbor, a youngster who might be in therapy, their therapist, grandparent, whatever. Anyone who the parents feel might be of support. People who can interpret the instructional implications of the evaluation, and that will include you folks. Most of you folks who are on this call, as well as the evaluator. I know sometimes I think with virtual meetings now, it's a little easier to have the evaluator actually at the meeting explaining the results, and then we want that evaluator to be explicit. And what are the implications for this for instruction and other life events, depending on the student that we're talking about. Okay. There might be an educational surrogate that's there if the youngster's in the state's custody. Sometimes they appoint a surrogate. And lastly, if appropriate, the student and the child. My experience has been that most don't want to attend when you provide them. Do you want to come to this meeting? If I know the youngster, I try to encourage them to come, but once in a while they come. But I think depending on the age of the student, that we should offer them that opportunity. Okay, so that's who's going to be at that meeting, minimally who's going to be at the meeting. Okay, all right. So just to kind of lay out who we're talking about during this series is what I've come to be known as students with complex profiles. And in my training, we used to call persons with low incidence population. These are kids who are not frequently occurring within the population, and that so bring unique challenges to us as evaluators and as service providers and as teachers, and so persons affected by autism spectrum disorder, multiple intellectual disabilities, TBI. Now, as I mentioned in the introduction, as I thought about our work together, if you're working in special education right now, you're aware that model where the psychologist used to come in and do a cognitive assessment, and then perhaps also do some achievement, or you might do the achievement testing, and we compare the scores, and then if there's a significant discrepancy difference between their cognitive score and their achievement score, that's suggestive of a specific learning disability, and that's known as the discrepancy model. Well, all of you are aware, if you're working in the public schools these days, that model is going away, and which is good. For years, I've been doing the wrong thing the best way that I could, but and I'll explain that as it progresses. It's some of the tools we choose allow us to use the discrepancy model in the most accurate way, but it's not the best way to identify a specific learning disability. And depending on where your district's heading, they're going to be asked to identify what are known as an evidence-based process for identifying learning disabilities. And two of the most common ones are what's known as the response to intervention model and a patterns of strengths and weakness model. Well, both of those models are dependent on the cross-battery assessment model. It's no longer where we're looking to see, is the youngster disabled or does the youngster have a disability? Now we're looking at why isn't the youngster performing to the level that we would hope given the services we're providing? And that's going to require evaluators to have an in-depth understanding of the variety of tools out there. So for example, In a RTI model or a patterns of strength and weakness model, when it eventually gets to the point where an evaluation is thought to be the best plan of action to help figure out what's happening, they're not asking, is the student eligible? They're asking questions like, okay, I've been providing reading instruction using this evidence-based program for 6 months, and the data shows me that he's really not gaining in his skills. And the other thing is, I provide instruction on Monday, and he comes in on Tuesday, and it's like he's never seen the information before. That's a whole different way of approaching it. Now those questions the team is going to develop is related to that. And so the psychologist or whoever is doing it's going to probably take a look at attentional issues, long-term memory, long-term retrieval, short-term memory. What are the things that might be contributing to this? It's no longer the broad picture. It's now, how do we get down to the nitty-gritty and diagnose what the issues are? And in order to do that, you have to have this in-depth understanding of the tools that are available to you. So this cross-battery assessment approach that we're going to talk about, that has been in place for students with low incidence disabilities, it's been in place for quite a while. It's now going to be used with our most common referral for an evaluation is for a suspected learning disability, and within that, the most common suspected disability is in the area of reading. And so those folks now are going to be exposed to this new model where we're going to have to figure out, why is it that, not that just that you have that discrepancy that suggests there's something going on. We want to know, why is it going on? Okay. Right. The question about what do we assess? So the regulations are quite clear about what we're to consider. So there's a difference between considering and assessing. And so according to the regs, we're supposed to consider each of these areas whenever we're conducting a comprehensive evaluation, and things like physical characteristics. And so you may have a youngster who who wears glasses. We know by checking with the nurse that his glasses prescription is up to date. Okay, we don't need to do anything more. We've considered that. However, you might have a student with a degenerative hearing loss, and you now may want to know, wait a minute, in order to we need to get an audiological done, because we want to know to what degree has his hearing changed over the past 3 years, whatever it might be. So depending on who it is, you may have to address something in each of these areas. Now the areas of adaptive behavior. Can the youngster or the individual in question respond to the day-to-day demands placed on him by our culture that are appropriate for their age? And I would suggest that not only includes the life space demands outside of school, but also in school, in terms of mobility, ability to get around school, ability to participate in a general setting. What are the things that are facilitating that participation? What are the things that are getting in the way? So we need to look at that, and we'll talk about some instruments later on that measure those. It asks us to consider, might there be a need for assistive technology? And I know that's a big one in the population that we're talking about. And if so, do we need to conduct an evaluation to determine what might be the most appropriate technology to use? And then we'd have a tryout, and again, more data to find out, are we going down the right track? They want us to, or the feds want us to, and the state wants us to take social, emotional, behavioral characteristics. It's so important to remember and recall that our students don't leave their suitcases full of baggage at the door when they come into school. If you have students who things haven't been going well with mom and dad, and now dad's living somewhere else, and I mean, that's kind of all these things, all these life events that happen outside of school impact kids' performance. This whole notion, some students start to feel a little yucky about themselves when they realize that they see other students progressing at a rate greater than themselves, and that has an impact on them. And sometimes they engage in self-defeating behavior that we need to address. Okay, speech characteristics. Boy, I tell anyone who's looking for a career, a young person, go into speech language. We have such a shortage, and our speech language pathologists that I know are just overworked and overextended. But anyway, just kudos to those folks. But anyway, there are speech things that we need to, and with our kids, that's frequently something that we need to look at. And then moving from speech to the whole notion, but different from speech, but language and communication skills. Is this someone who has a augmentative communication system? Is this someone who might consider for signing or whatever it might be? And then vocational needs. This is true, and this is, Vermont is, just as kind of an aside, I don't know if people remember Susan Hazazi, but it was her research and her advocacy at the federal level who got this whole vocational transition stuff going and across the country, and not just in Vermont. And years ago, she did a survey of young people who had graduated from high school and with significant challenges, and what were they up to? And she found that most of them were not up to much. And so that's what spurred the whole notion of, if we now start transitioning services to adult services early on in high school, get everyone on the team, and we start going, and other things that we can start, are there assessments we need to do, or do we need to address certain skills that a youngster needs in order to be successful in a vocational environment? And then skills in the learning environment. What skills does this youngster have, and it has to have to participate in the learning environment? And that can be anything from orienting in the direction of the speaker to taking notes, or whatever it might be that they might be getting in the way of the individual's progress there. I forgot to mention that we're going to take a break at 10 minutes before the hour each hour, so you can get out of your virtual seats. And so I just want to let you know that'll be happening. Okay, all right. And then look at all this stuff. We're asked to, what are relevant life circumstances? I mentioned the one about the family, community. I've been in situations where the youngsters are living in this small community with lots of families nearby, and there's a feud between a couple of the families, and this gets carried on into school. This can have an influence. So anyway, and any kind of environmental factors that might be getting in the way, accessibility issues, and things like that. Okay, and then we're going to look at intellectual or cognitive characteristics, and you folks mentioned this. And then the regs we're going to see in a minute. It says we're not really interested in that big old score that says, okay, here's your IQ or your GIA or whatever, but we're really interested in, and what are your strengths, what are your learning abilities, and in particular, your reasoning abilities. And then lastly, of the things that we have to get is, that's why we're here, basic skills. Purpose of education is to inculcate the skills that are listed here, and we're going to want to evaluate each of these to be sure that, as you said, if it's initial evaluation, to establish the baseline, and so we'll know where the individual strengths and challenges are within these skill areas, and then inform our instruction and our IEP development. Okay. What are we going to use? Okay, so this is key right here. I don't know if it's showing up red on yours, but to ensure that if an assessment is administered to a child with impaired sensory, manual, or speaking skills, the assessment results accurately reflect the child's aptitude or achievement level, or whatever other factors the test purports to measure, rather than reflecting the child's impaired sensory, manual, and speaking skills. That's a mouthful, but I see it happen all the time, where I'll conduct a record review, and an evaluator has administered a test, and I know that this youngster could not participate fully in this test because of their disability. And in the report, it says that that test score is an accurate reflection of the skills, which is not true. And so In this day and age, you would think that wouldn't be happening, but it continues to happen. So what this is telling us is when we talk about our cross-battery assessment, we have to pick things, assessment tools that the youngster can participate in, and then not tools that are measuring the fact that they're affected by cerebral palsy and their motor movements are choppy and they can't put a set of blocks together within a certain specific time amount. So their inability to do that is a result of their motor skills, not because their visual spatial skills tell them that they're not able to do that. Okay. The second thing they warn us about is the tests that we use. Those tailored to assess specific areas of educational need and not merely those designed to provide a single general intelligence quotient. So we're going to get into this later, but there are some cognitive tests out there that, well, so what happens is every cognitive test is going to give you a big score. And in most cases, I would say nearly all cases, that big score is reliable and valid. And we'll talk about what that means in a little bit. However, many tests, that big score might be comprised of 10 what are known as subtest scores. And those subtest scores are not reliable enough to draw conclusions about what each subtest is measuring in many cases. So there's a statistical phenomenon that the more data you have, the more reliable your score becomes. So when you have an IQ score that contributes, is made up of 10 subtests, and we'll say that perhaps 8 of them don't have high enough reliability, but the combination of those result in a reliable overall score. So that may be helpful in terms of determining, say, eligibility for a particular program if your intelligence or your cognitive has to fall at a certain level. But it doesn't help us in figuring out what's going on, the educational need, what are the strengths, what are the challenges. And so that's one of our first terms. There's not going to be a quiz, but here's one of my first terms I want us to distinguish. The difference between a test and a subtest is that a test can stand alone by itself because it has high enough reliability and validity. A subtest has been found not to have high enough reliability and validity. And so it needs to be combined with other tests, and sometimes that'll be called an index score. So for example, you might have 2 tests that measure visual processing on a test, neither of which have strong enough reliability. But when you combine them, you get what might be called the visual processing index. So it's a composite score, a combination of 2, which now has a reliable score because of the statistics involved. But you have to be careful about drawing too many conclusions about the performance on the individual tests that comprise that because of the reliability. And we'll talk about what we're looking for in reliability. Okay. And then lastly on this slide, ensure that assessment tools and strategies provide relevant information to directly assist the IEP team in determining that educational needs. This goes not only to the strategies, but to the scores. So here's a rhetorical question, because I know you can't all answer, but suppose I were to do an adaptive behavior assessment of one of your students who's in the 2nd grade and he's 8 years old. And then I tell you that he has an age equivalent score of 3 years old, 5 months. He's performing at a 3 years old, 5 months level. Does that help you determine strategies and provide relevant, useful information in terms of meeting this youngster's needs? I would suggest no. And so we're going to look at the kind of scores that we're going to be looking for and that we are entitled to ask for from people who we contract with, but also that we should be providing or selecting for use to give more accurate information about what's happening with a youngster. Okay. All right. So how the heck are we going to do this whole thing? We're going to use a variety of assessment tools and strategies. And it tells us we can. Look at this. It says, this is right from the regs, use a variety of assessment and tools and strategies to gather relevant functional, developmental, and academic information. So this is telling us that we can be as creative as possible And as long as we follow some guidelines, which we're going to review, so we can be creative as possible in terms of gathering assessment information, the practices we use, the strategies we use, as long as we do adhere to some guidelines. We'll talk about what those might be. Okay. Here's my favorite school. What's an assessment tool? It's anything. Any sample of a student's behavior is an assessment. So, for example, not too long ago, I was working with a youngster and his team doing evaluation, and one of the things came up with, well, he was a youngster who was on the autism spectrum disorder, and however, was very interested in, and he was in the high school, he was a high school student, very interested in making connections with his peers. And when he did so, he would do it nose to nose, which is kind of creepy for most high school students. So we had to work with this student to talk about the body bubble, a little imaginary circle around us, and that didn't work. So then we decided the floors in the school were made out of these 1 foot by 1 foot tiles. And we said, okay, here's what we're going to do, Elwood. You have to be 3 tiles away from a student when you stop to talk to them. And so one of the assessment strategies we picked up was just he had a support person who was in the area most of the school day. Is that person would just had a sheet, would take a look, and when he made an introduction to a student, they check to see if it was a 3. That's an assessment tool. Is he 3 feet from? We can determine. If not, and from that's a pretty basic one, but they can become very complex and very sophisticated depending on what we're looking at. So, assessment tool or strategy is any sample of a student's behavior. Okay, so let me look at the time. We have 3 minutes before our quick break, but so I want to talk a little bit about the different types of assessments that are out there, because sometimes we get mixed up on what they actually mean. So a standardized assessment merely means that it has rules that we must follow in terms of administration and scoring. And if those of you have done this will have noticed the pattern that everything that we need to say typically is in bold blueprint, and we cannot deviate from what that says. It will typically provide us what are the correct answers, what are the incorrect answers. We can't deviate from that. We got to be fairly strict. And so standardized means that if I administer the test or you administer the test, we both do it in the same way, we both score it, and then come up with the same results. That's also known as inter-rater reliability. And so the better standardized the test that we have, the better our inter-rater reliability. We're going to talk a little bit about error in assessment. The greatest source of error in every assessment or every measurement is you and me. And so we have to be careful to attend to the standardized procedures and tests. Having said that, when we get into the cross-battery approach, there are going to be times when it's okay to deviate from the standardized piece if we believe it's going to provide us with useful information and if it doesn't change what the test is actually measuring. So here's a good example of what we shouldn't do. So suppose we're measuring a reading assessment, and we want to measure reading comprehension, and the youngster's having difficulty reading the test. So what we decide to do is, well, I'm going to read the test to them and see they comprehend what we measured, what we've read. And then the test, so let's make believe we're using the gray oral reading test. So the test comes with a number of multiple choice answers, questions. I would pose those and all that. Well, that's a nice accommodation, but now what we're doing is now we're measuring listening comprehension, right? We're not measuring reading comprehension. So there's a time where we might want to do that and it would be okay, but we have to recognize that we're no longer measuring reading comprehension, we're measuring listening comprehension. And there might be a time where we want to know that. And we happen to have a gray oral reading test, and yeah, this would fit nicely. And so there are times and that's kind of the basis of the cross-battery approach, where we're going to make some adjustments, but we're going to do it in such a way that we can get some valid results.
Are you doing anything in districts anymore? Or are you just, so if you sound pretty busy?
I am not doing stuff in district stuff.
Yeah.
I've got, I'm helping out in the community where I live because they needed someone in an emergency situation. And that's, I kind of, between you and I wish I hadn't involved, but I'm doing it and it's working out okay. So that's keeping me busy. So I have one district, I'm helping them out. And then between I've cut back between the teaching and
Yeah.
I'm a Cub leader now, and I'm on
Oh,
the
wow.
select board and doing all these other things. So,
Yeah, you sound pretty busy. I figured that, but yeah, I just wondered because if the community that you're in, that you're talking about, that can be mirrored across the state of Vermont. You know that, right?
yeah.
And so when you say all these things, these are all the idealistic,
Yeah,
but not the reality.
that's a good point. That this is us doing the right thing if hopefully we have the resources to do it.
Right.
That's a
Right.
good point. The upside of that is that means that someone's paying attention to the research and the evidence and suggesting that maybe it's true with everything. Something we thought was a good idea 10 years ago maybe isn't such a good idea after all. And that the research isn't supporting it to the degree that we thought it might often go. So it's a pain in the neck that, like you say, to have this storeroom full of this stuff, but the other end, okay, it costs us, okay, what's the more robust way to deal with our literacy efforts? So I just want to go through these different types of assessments because they create problems for us sometimes if people don't fully understand what they are. And that's one of the things that came up that I see in experience in team meetings, and I would just want to go through. So our next kind of test is what's known as a norm reference test. Norm reference tests are almost always standardized. So that means that you got to follow the rules. You got to score it the correct way they say. You got to use the language they say. You got to administer it in the way that they prescribe. So norm reference tests give you a measure of a student's relative standing within the group. And so whoever's ever in the norm, most of these tests have an average score of 100 and a standard deviation, and we'll talk about that, of 15. Standard deviation, a way to think about that is that standard difference or average difference. So most of them have a standard deviation of 15. And so that means it's okay to be 15 points difference in one way or the other. So for example, the score would be 15 points below the mean, which is 100, would be 85, and 15 points above the mean would be 118. 115. Sorry, caught me on my math. And so that defines statistically the average range. And so the test, so that's going to be important when we talk about sharing out results, because sometimes parents are going to hear numbers that don't make sense. And so norm reference, you're compared to other people in the norm sample. Now here's the biggie. Is the youngster sitting across from me in the norm sample? If the answer is no, that is probably not an appropriate test to use for a high stakes decision like eligibility. But having said that, if we start a cross battery approach and we're starting to look for ways to reliably measure someone's skills, we might make an exception and say, okay, so it's a case-by-case basis. We might use a portion of this test, even though this youngster isn't in the norm sample, because it might provide us with some valuable information. Here's where it's going to get a little complicated for mom and dad and even some teachers. So so when we're reporting results out. So one thing we do, if a youngster is having multiple domains assessed, so we're administering the youngster's cognitive skills, but we also suspect that, I wonder if he has an attention deficit disorder. So we might be administering some behavioral assessments. And those behavioral assessments that psychologists use have a mean of 50 and a standard deviation of 10. So that means, on one hand, I might say to a parent, your youngster has a score of 60 on this test of cognitive abilities, which suggests significant impairment. And on this other test he had of self-regulation, he has a score of 60, which is a standard deviation above the mean, which is a good thing, which means he has good regulation. Well, wait a minute, mom and dad are saying, how can these two scores of 60 and 60 have such different meanings? So when we're reporting out results, we have to be really careful to explain to the parents what the scores are and what's the metric, what does that metric mean? So
when you say that for the norm reference tests, that they're not going to work for students that are not within the norm, like, are you just talking about students with like low incidence disabilities? Or would it be like any student with a disability?
No, it could be a student who is a new American from the Republic of, from Africa, one of the countries in Africa. That person's not going to be in a norm sample. So it's a general guidance that you want to be sure that the person sitting across from you is in the norm sample if you're going to use that for a high stakes. So it's true of kids who are bilingual, who are coming in, who might not be in the norm sample. And so in that case, you're going to be really careful with how to use it. I'm not suggesting that there might be a portion of that test that might be valuable to yield some valuable information, but we would use it through that lens that it's not totally reflective of who he is, because there's no one in that norm sample that's be compared to, but we might still gain some information because they can do this task, if you know what I mean, that we've determined that they're able to perform this. And that might just be enough for us to give us some useful information.
Okay, thank you.
Okay. Hey, thanks for the question. That worked out perfectly. I can even see you and everything. Great, thanks. All right. So norm reference, it's telling you where is this individual sitting in front of you stand relative to everyone else in the norm sample, and it's typically, the average range is typically defined as one standard deviation above the mean, one below, 85 to 115. Okay. Criterion, other questions about norm reference tests? Okay. Criterion reference tests are tests where somebody has decided this is what you should be able to do if you are a certain age, a certain grade level, and they typically will order them in a developmental fashion. And what will happen is when you assess a student, their raw score then gets compared to somewhere on that continuum, and they usually will yield a developmental score, an age equivalent score, or a grade equivalent score. Or sometimes now they're being a little more sophisticated, they'll call it proficient, and they'll have other terms of proficient or nearly proficient, whatever it might be. Now, here's where we run into trouble in our EPT meetings, educational planning team meetings, where we're reporting out results. A norm so here's something that happens frequently. We've administered a norm reference writing assessment, okay? And the youngster's score falls within the average range. We'll say it's a 90, it's a 95. But then this classroom teacher has been administering assessments that are based on the national or the state standards that have criterion that are listed that a group of experts believed students should be able to do at that point in time. And so those are usually ambitious. And that's not a bad thing. We're going to talk about goal setting. And if we set ambitious goals, we put high expectations both on the youngster and ourselves to achieve those goals. But they don't match. So what will happen is you'll be reporting out results, and the classroom teacher will become somewhat upset because, wait a minute, I've been administering all these assessments in class, and he can barely do da-da-da, and they'll see a huge distinction between the two. And so what the difference is in a norm reference test, the youngster is performing relative to what other kids that youngster's age could really actually do. That's what they really actually did during this test. On a criterion reference test, the youngsters being compared to what some experts decided the youngster should be able to do at that point. And so it sometimes can be arbitrary, but they're typically developed by a group of experts in the area. So do you see the difference there and how that can create some confusion when we're reporting out results? Okay. Criterion curriculum-based assessments. I'm going to give an example of what one of these looks like. Is an assessment that is typically a classroom-based assessment, but as special educators, you might do them as well. And what it does is it takes a look at the instruction we've been providing over the period of time, and then assesses those skills that. So let's say it's a 4-week period. I've been providing math instruction over a 4-week period, and I have assessed these various skills. So I administer an assessment to my class, and everyone takes the assessment, and I review the results. And I notice that everyone's doing pretty good, except for this aspect of math that I was teaching. So that tells me I need to go back and teach that piece again, as well as continue through whatever my scope and sequences of my math instruction. And then the next month, again, when I do, or 2 weeks, whenever I do my assessment, I'm going to include that element on that assessment again, along with any new elements that I've taught over that month. And so it's a recursive way to let me know is our youngsters keeping track, keeping up with the instruction I'm providing, and it gives me information to go back and provide supplemental or different kind of instruction if the group of students are not getting a particular piece, rather than continuing to plow forward and leave those kids behind. Okay. So, and again, if any questions pop up about any of these, don't hesitate to ask. I'm going to give an example. I have an example of what that might look like when we get to another slide. Curriculum-based measurement, they sound the same, but they're very different. What curriculum-based measurements are, these are assessments that look at underlying skills that you need to be successful to complete a terminal skill. So the most commonly occurring CBMs or curriculum-based measurements that we're going to see are in the area of reading. So in order to be a good reader, you need to know your letter names. So there'll be a curriculum-based measurement for letter names, and they're always timed, because if you can do something quickly and accurately, it means that you've mastered the thing. So the skill. And so they'll have measures of letter. And then we progress. Okay, can you say letter sounds? Then we move on to that. And then we progress. And the next curriculum-based assessment might be, can you read CVC words? And on and on. And so these are we're going to see in a slide later. These are actually curriculum-based measures are really good for measuring progress if we are setting up. So if that's one of our goals is Elwood needs to learn the letter sounds associated with each letter, and then with graphemes and things like that. Then you could use these to measure your growth along the way. And the other thing, when we look at the slide that delineates this, they are frequently, and it's recommended that the results be graphically represented so that everyone can see what's happening. Okay. All right. And we'll look at those called CBMs, and there's a lot of commercially available ones, but sometimes people can make their own up, but we're going to look at some of those. Ecological assessment. This is the biggie. I would never conduct an evaluation of a student without observing that student in the classroom. That's the most important environment in which this youngster functions. So we need to get in there and take a peek at what's the structure of the classroom, how it's instructed. It's just not the individual, but what's the whole environment though? What's the seating like? How is the youngster in focus responding to the instruction? So we want to get right within the environment. And sometimes it's the environment's home. I've been my situation. I laugh because the outcome is fairly funny. Is this whole situation? It's called selective mutism, where you have youngsters who will not talk in school or won't talk. And more often than not, the parents will tell you, she's a chatterbox at home or he's a chatterbox at home, but will not talk at school. So one of the things I do is, okay, Mom, what time does Mary get home from school? Well, she gets home from school at 2:00. All right, can I come over at 1:45? So I go in, I make myself comfortable in a place of the house where the youngster can't see me. She comes through the door, yakking away, talking to Mom. She spots me, and then what happens? She stops talking. But now we know this youngster does not have communication issues, does not have language issues. It's strictly the issues. It's considered to be anxious about teaching and talking at school. And so the ecological piece then happened in the home. Sometimes we got to get people on the bus. What's going on the bus? Youngsters who are having difficulty getting to the bus, getting to and from school without getting written up or whatever it might be. Error analysis. This is hugely important. If any of you have taken an assessment course with me, you know that I put a huge emphasis on this. It is no help for me to write my report that Elwood obtained a score of 80 on this test of math calculation. So 80 falls, it's more than the standard deviation below the mean, and that's how we define a deficit. So that's a significant deficit. It's more than 15 points below the mean. That's not helpful to Emily as the teacher who's going to be providing the instruction. So in my report, I have to write what the youngster could do and what they couldn't do. And that's what's going to be in the report. So, and we need to ask for that. So part of when we get into the educational planning team meetings and what we need to do there, it's incumbent upon us to ask these questions so that we get the answers. So we're going to want our evaluators, or if our colleagues and are on the team doing it, we have to make sure that we're getting that information to the people who need it, the special educator and the classroom teacher. What could the youngster do? What couldn't they didn't do? And then this also goes towards IEP development. Okay, of the things they couldn't do, what are the most important to us as a team and what are we going to focus on? Because frequently you can't focus on everything. Dynamic assessment is a broad term for what we do when we're providing instruction to a student and we're watching what's happening and we're determining, yep, they're making growth, or this suggests evidence of growth, this suggests evidence of growth, and we're making adjustments to our instruction based on what's happening there. It's kind of an ongoing process. There are one or two tests on the market that actually, we'll look at one of them, that actually has incorporated into it a dynamic assessment piece whereby during the evaluation, the evaluator teaches the youngster a skill or an activity they've never done before. And then we observe to see how well they progress through that skill. And so they're called controlled learning tasks, where we're teaching them something they didn't do, and we're going to see what they actually could do. Okay, checklists. Some of them are these are like up here. Some of them are norm referenced. Some are just serve as guidance. Some of them are more criterion reference. So for example, I know the I-Team has a number of checklists that I've reviewed that whereby they provide a nice sequence of what are the skills you need to have in order to be a mathematician? What are the skills to be a reader? And you just can look at those and say, okay, what are the skills that this youngster possesses, and what are the ones that they don't? And then it helps us guide our instruction. Other checklists are kind of fall within the notions of the same realm as rating scales, whereby they tend to be norm referenced, and as I said earlier, they're going to tend to be have a mean of 50. So if you get a score of 50, it means you're right where you need to be for someone your age, and then with a standard deviation of 10 on either side. So depending on the test, a high score might mean that you're doing well, or a high score might mean you're not doing well. Depends on the test. We have rating scales for all sorts of things: anxiety, depression, attention. So it's pretty typical. If you have a question about something, that will be able to find a rating scale that would be appropriate to the youngster. And then any kind of student-centered assessments, and those are similar to the ecological assessment, whereby, okay, I've been in here, I've been scoping out the environment. Now I'm going to scope out Elwood's response to instruction environment. And I typically will ask the teacher or your evaluator or yourself, if you're doing, is to identify, and this is again combining with observations, identify a typical student so I can get a sense for how is the youngster of my focus responding relative to a typical student, because sometimes things go awry. A teacher might be trying out a new unit and they've never done it before, and before you know it, it's not going smoothly, and the entire class is starting to lose it. She's losing the focus and attention of, well, if my student of focus is also losing attention and focus, that wouldn't count against them because it's relative to the whole class. And then observations refer to these kind of student-centered and these ecological assessments, but also your time with an individual. What have you noted? What does this youngster like? What do they dislike? How do they this is key. When we get into the cross-battery assessment piece, we're going to look at the steps that you need to do to conduct one of those. And one of the steps is to get to know the student. And so I'm going to be really relying on Emily and the classroom students, classroom teachers, and the parents. Help me get to know, what have you observed? What does the student like? What they don't like? Is it preferable to place visual information to the right or to the left? Is their hearing in one ear stronger than the other ear? Do they have more motor control in the left arm versus the right? All these different things that you've observed that are going to help us to provide an assessment that's fair and does not tap into the least possible way, does not tap into their actually diagnosed disability. All right. I suspect there are other types of assessments, but that's a pretty darn good list we got there. All right. So things that can affect the accurate assessment. These seem like some of these might be no-brainers, but I've seen people, psychologists to ignore these. The ability of participant to understand the assessment stimuli. If they don't get what I'm asking you to do, then that's going to be reflected in their performance. They're going to be responding randomly, et cetera, et cetera. So that's going to be the ability to respond. So if I'm using the Wechsler scales, one of the things you have to do is you have to take these little blocks and put them together as part of a measure of your visual spatial thinking skills. And if you're affected by cerebral palsy and you have erratic movements, it's going to take you longer. And in fact, you lose points if they're not aligned in a certain specific way. That's not a fair assessment. Appropriate norm comparisons. Again, as we talked about that earlier, you want to be sure that the person that you're evaluating is in the norm sample. And I am pleased to say that more and more tests are broadening the scope of the people in their norm sample. And so, for example, one of the things that I do, I should have said this earlier. There's a disclaimer, full disclosure. I also have a relationship with Riverside Publishing, which publishes tests. And the reason I have a relationship with them is because every test they publish meets the highest levels of quality that we're looking for in tests, which is why I've stuck with them over the years. It's not to suggest I don't have other tests that I use, but their tests tend to be my go-to test. So one of the things, I'm involved in the development and norming of the next iteration of a group of tests coming out of Riverside. And one of the things that I've noticed they're looking for children who have a diagnosis of ADHD. They're looking for children who have diagnosis of autism. They're looking for students who will broaden out the scope of the norm sample so that we can feel more comfortable about making norm comparisons to that. Okay. The appropriateness and the level of the items. And so if we have a youngster and where we're interested in their math skills, but the test that we're using perhaps doesn't go down low enough to measure some of those early fundamental skills, then we might just get a score that reflects the fact that they don't really have these higher order skills. And we don't know if they have these lower fundamental skills that contribute to being a mathematician. So we need to look at, okay, is the level, and also is the breadth, does it go high enough to look at, to be sure that we're challenging students in getting into the areas that they may have skill in. One of the things I tell youngsters whenever I'm working with them is that I tell them the material depends. So I was with a middle school student this week, and I said, okay, see these books, you don't have to do everything in these books. I use these books with middle school, elementary, middle school, high school, and even some college. And we're going to do the middle school stuff. But then one of the things I tell them is that that middle school students sometimes know stuff that high school students know. And so I'm going to ask you some high school stuff too. And you'll know I'm doing that because it's going to feel a little harder. And that's when I want you to try your best. So there's a couple of reasons why I'm telling them this. One is that the most important one is that the youngster's been referred. So there's clearly going to be some challenges with this test that I'm administering. And I want him to know that it's okay if he gets some wrong, and not often than not. So for example, this little 6th grade student, when things started to fall apart and they couldn't do it, says, these are high school ones, aren't they? And I said, they sure are. Okay, let's do one more and then we can stop. The tests that we use with youngsters are nearly always upwardly spiraling in difficulty. And so they start off with youngsters, and we typically will start off at an age level or a grade level that we think the youngster can, this is my practice, and I hope the practice of other psychologists and evaluators, that they can be successful. So they start out, no harm, no foul. They're doing items that we believe, and then they move into the other items and they get more challenging. And because it's standardized, it says, do not stop testing until the youngster gets 6 in a row wrong. Well, the youngster knows they're getting them wrong, and that's kind of a painful situation. But when it's tempered with the notion where they can say, those are high school ones, it makes things feel a little better and go a little smoother. Okay. Exposure to the material being assessed if they're doing something they've never been done before because of perhaps limited educational experience, whatever, that's going to have a piece. The relationship with the evaluator is key. Now, there are some times where you're going to have contracted evaluators, and I can only tell you what I do is I don't do anything until I believe the youngster is comfortable. So usually I have already interviewed the parents and I have had some conversation with the teachers. And so I have a sense for what they're into, what they're good at, what's the challenges are. And I'll get a conversation going about, so for example, the little guy was this week with, he's in Scouts. Well, I just happened to get roped. Oops, did I say roped in? I happen to be a newly appointed Scout leader because of, anyway, so we were able to make that connection. We talked about scouting. Then he's also a skier. So we talked about skiing where I ski at the same place he skis, and bingo, he was comfortable as heck. And then we dove right in. And so that's, that's really important. The other thing is that I'm famous for my treasure chest. If you're an elementary student, I'm going to let you know that I'm expecting you to do your best. And anyone who does their best gets to pick from the treasure chest. And it has Lego kits in it and dolls and all sorts of little things. And it provides a little motivation on the other end for the youngsters to participate to the highest level. Okay. Evaluated related variables. It's a small state, but you know, you gotta be relaxed, you gotta be calm, you gotta be somewhat fun to be with. If you have an evaluator who's kind of a stiff, and when I got out of psychology school 43 years ago, I was taught it was called the robotic model. You couldn't show expressions, you just stick to the book, read what it says, and that doesn't work. So I quickly adopted the more, out there model. Let's chit chat, take breaks, things like that. And so you have to be perceived as approachable and and the youngster has to be comfortable with you. Lastly, but not the environment. Oh my goodness. As someone who, all our schools are really tight for space. And I'll tell you, one of the worst situations I ever had was I showed up at a school to evaluate a youngster who they suspected had an emotional behavioral disorder. And when I got to the school, they walked me through the school, then out the back door. And on the parking lot, there was an abandoned trailer. So I went into the trailer, and in that trailer were all sorts of things stored all over the place. This is a true story. They took me into the bathroom of this trailer, and in the bathroom, everything had been taken out, and there was even a hole in the floor where the toilet was. And this is where I was going to be. And as you might guess, I said, this ain't happening. What a message are you sending to this kid? You're sending to the, so anyway, that aside, the noise, yeah, we have to have a quiet space. Most of our buildings are made out of these cinder block rooms that they put us in. Our voice reverberates all over the place. So if there are a hearing issue, that's great problem. So we try to get the most the most quiet and the most comfortable environment in order to get things done. While in this environment, as the evaluators, we need to be cognizant of the youngster's performance. As soon as we see it to degrade, or they're losing interest, or they're becoming fatigued, then we need to stop. I once worked with a young gal who was affected by cerebral palsy, and it affected her core. And she was a trooper, and when she created speech, it was exhausting. And she would be breathing heavily, but just run. And so we would have to take frequent breaks, and we had to do it over a number of periods. And so that's one of the hallmarks of these cross battery assessments we're going to be talking about. We have to be patient, we have to be creative, and it might take longer than we ordinarily would see in a typical evaluation, but the results we're going to get are worth it. One of the courses I've taught in the past is supporting children with learning differences. So what we do is we learn about how does ADHD affect a student? How does cerebral palsy affect? How does emotional disturbance affect a student's learning? And for the first 3 weeks of the course, this is a graduate level course, we talk about relationship building. And I can see people like they're running in place. Wait, when are we going to start talking about how do you support kids with an emotional disturbance? How do you support kids with ADHD? So then when we finally get to the detail about supporting kids with, say, an attention disorder, when I ask the questions to the group, what's the most important thing do you think for a kid who presents this way? They now say, oh, we got to have a relationship with these kids. And you're absolutely right. Relationship relates. So I call it the other R. Relationships comes first, then reading, writing, and arithmetic. So I think it was Valerie who said that. I couldn't agree more. It's so important and you're going to get much more out of your students. They're much more willing to work with someone for hard. Some of these students working really hard. They're much more willing to work really hard for someone who they care about, who they believe cares about them, and then you get better results.
I just had a quick question, or kind of wanted to get your thoughts on just doing like kind of 20-minute a day type of situations, because, given the school and having to service other kids, that's kind of where I feel like I end up. I'm like, okay, we have 20 minutes. Let's kind of get as much as we can done. I know you said usually it does take a long period of time to get through stuff. I mean, I feel like I see good success from it because then my students don't get burnt out.
Yeah.
It's not this, 2-hour period of asking them all these questions and then it affects the results.
I would agree. If so, the only caveat, so 20 minutes is perfect. I mean, that most kids can pretend and focus, and you're going to get your best results in that 20-minute period. My only caveat is that some tests or activities need to be completed from the start to finish. And so if you're able to do that, so for example, the SRUM tests are, so these controlled learning tests that I do with youngsters, they take longer than 20 minutes, and I couldn't stop because it builds on itself. And so there are certain times where I can't do that, but there are other times where in the middle of a test, depending, so if it's a test that's item by item that gets a little trickier, I'm noticing that I've lost this kid. He's not with me anymore. It's okay to stop there because the subsequent items don't build on the prior items. And so that would be the only caveat. But that if you can pull off 20 minutes to get, that's to your advantage. It fits in your schedule, and it's the student's advantage because 20 minutes is an optimal time for youngsters. Most kids can focus for 20 minutes. Yeah.
If that.
So that just points out, Leah, that all the things that we have to do. And I might be biased, but I think the assessment piece is one of the most important parts because that informs everything else. And so to be squeezing this, don't get me wrong, to be squeezing this in 20 minutes, that just shows how busy you are with all your other things. But the fact that you're getting 20 quality minutes a day, that's the way to go.
You're thinking about an EBD kid or an ADHD kid, and like when we do track my progress, which is done 3 times a year in our school, I have an EBD kid that you would get absolutely nothing from if you put him down in front of that test and said, do it. But if I sit right with him and provide, like say, okay, we're going to do 4 items and I can see what he's doing. So it's appropriate to stop, and then we'll take a break and we'll do something that you like, he likes to look up the biggest snake in the world or something like that. And then we go back to the test. I'm just wondering, when does that make the test invalid? Like those kind of supports.
Right. I don't think that you've described anything. So it sounds like it's the benchmark you're doing beginning, mid-year. I didn't hear anything that you said that invalidates that test.
Okay, so if I put a ruler in where he's reading and bring it down as he's reading, okay. So unless it tells that it's allowed. So here you raise a great question. So depending on some tests will tell you that if it's an allowed accommodation that the youngster already has for other school things, they'll allow it for their test. But other tests will tell you cannot use rulers or things like that. And that's particularly true of time tests because they don't want that interfering with their youngsters' fluid movement from line to line. So you would have to check to see what they say about it. But even so, here's the deal. Even if they say that's not an allowed accommodation, here's your choice. You get nothing or you get something with this accommodation. So I would err in the side of I'm going to get something with this accommodation, and then the accommodation tells you that this is an effective accommodation that we might generalize and use elsewhere. And so this is not unusual. So for example, there's a written expression test that I will administer to youngsters, and youngsters tend to do better on this written expression test than they do on other written expression tests because the one I administer is a sentence starter. You start the sentence and then they have to finish it. The other one I give it has word bank, and they pick the words from it and then they have to write sentences. So when I write my report and I've done a record review and I've seen that, boy, this kid does poorly on other in-class writing assignments, in my report, I talk about the fact that he was provided with sentence starters and he was provided with a word bank, and that contributed to success. This is an accommodation not only would Elwood benefit, but likely all his classmates. So let's get word banks going. Let's get sentence starters. And so that's that's one of those observations or error analysis things that we want from the evaluators to kind of give us hints on what we need to do. And what you're doing is the same thing. You're seeing that even if it's not allowed, by you allowing to use a paper to do the lines, he's a more proficient reader. Let's do it until he doesn't need to do it. So here's where the whole idea is: you're only
and this is by design and by law, you're only going to get back what you ask. If you contract me to do an evaluation and you ask specific questions, I can't sit down and when I meet the youngsters say, well, geez, they didn't ask about this. I'm going to look at that or that. This is a contract between you, me, and the parents that we have to follow. And so what goes into that evaluation plan is what you're going to get back. And I'm also going to say that if you get your report back or your results back and the person who has been charged with doing this evaluation hasn't responded to those questions, then you send it back and say, wait a minute, we need these answers to the specific questions you ask. And we're going to talk about, the more specific we get, the more helpful it is. So for me, it's not unusual that I find if I'm not a part of the educational planning team meeting and I get I get emailed and there's an evaluation plan in it, more often than not, I find myself calling the special educator and saying, I want to review this to be sure I understand what you're asking here, and bing, 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 and make sure I'm on the right page, because I can't go any further than what they ask, and I'm obligated to respond to the questions they did ask. Here's a common question. What's Elwood's current level of cognitive ability? Okay, so by asking that question, you're going to get the response. Well, his level of cognitive ability is 85, which falls within the low average range of cognitive functioning. Not that helpful. Okay, but if we ask, what are the relative strengths and challenges within Elwood's cognitive profile? So what that requires the evaluator to do, and this applies not just for cognitive, but for every skill area, is to take a look at, and by what we mean by relative strength is some of the students that we're talking about here might have a profile that everything is significantly below the mean in terms of what we're measuring, but some might be a bit higher, some might be a bit lower. So the relative strength refers to that this is one of the strengths that, although it might be in the low average range still, or the below average range still, compared to Elwood's other performance, this is a relative strength that we should take advantage of and tap into. So we want that information. Okay. We want to ask questions like, what does Elwood's cognitive profile tell us about potential instructional strategies and approach? So given what we've learned about them, are there certain things that you know about providing reading instruction, written expression instruction, navigating the school that would be beneficial, that you predict or suppose might work for Elwood given his presentation? Okay. Another one, what is Elwood's current level of adaptive behavior? If it's a youngster who we suspect has an intellectual disability, we have to ask that question as part of the eligibility piece, but we need to go further and say, okay, relative to strengths and challenges within adaptive, what are they? What does he tend to be better at? We have some young people who might be on the social domain might be very strong, but on the academic and self-care domain might be low. And then we might also want to ask, I don't have it here, we might want to ask the question, given Elwood's adaptive behavior profile, what recommendations would be made for targeting skill development? What might come next? Do you have recommendations for the team? What can he do? What can he do? What do you think might be the next place to start? Whatever in terms of building and improving his overall adaptive behavior in this case. All right, here comes the fun. If you're a quantoid, you're in for a ride. I love this stuff. So, but I'm going to be gentle, but there are some statistics and psychometric things that we need to understand so we can advocate for our students, and so we can also have we can inform the tests that we use when we start looking at this cross battery piece, whereby we're matching tests to the students that are central focus. So reliability just refers to, hey, can I be confident in these results? Are they consistent? And can I hang my hat at? Can I feel comfortable going to a meeting saying this score actually represents the skill that it's measuring? So just as a kind of a benchmark, if you're making a life altering or an important decision about a youngster, and you're using test data, that test data has to have a reliability of 0.9 or above. Okay, and you can ask your evaluators, or you can, to be sure that they use tools that meet that standard. Also yourselves, look at your materials, check in the manuals, check to see if the reliabilities. One thing you'll notice is the reliability sometimes change with age. So you might have a youngster who is 8 years old and a certain test, it's not, reliability is not that great, but then at 12-year-old, it tends to become a little more reliable. So it takes, this is going to be what's part of the new world order for assessment in terms of applying good practices to children experiencing low disabilities, in addition to all the other assessments we're going to be doing under a responsiveness to intervention model or a patterns of strength or weakness model. Just want to mention something. Other people refer to it as MTSS, and that's the term that the state has adopted. It. I'm sticking with the RTI model because a tiered system of approach is one part of the RTI model. But there are so many other parts that are so important for this model to be successful that they have to be attended to, things like screening and progress monitoring, stuff like that. So anyway, I stick with the RTI rather than the MTSS, just so you know, we're talking about a similar thing, but when I talk about RTI, it's more comprehensive approach. Okay, so one of the things to think about this reliability. So secondly, so if you're going to use data from a variety of sources to contribute to a decision, then that data can have a reliability of 0.8 or above. And so if you're having multiple data points to help you decide, yeah, this is a strength or this is a significant challenge, it's a direction we should go in terms of programming, then multiple data points at a lower reliability is acceptable. I want you to think about something. There are some tests out there that have reliabilities. They're fewer and far between because we become better informed consumers, and test developers are getting better at the test development. But there are some tests out there that have a reliability of 0.7. And so whenever you square the reliability, it's called the reliability coefficient. Whenever you square that, that tells you how much of the score that you're seeing represents the actual skill you're measuring and how much represents error. So think about this. If you square 0.7, which is the reliability of a particular math test you might be using, that's 49. So that means that 49% of the score you just received is reflective of this math ability, and 51% is something else. So you may as well flip a coin. So we should never be using any tests that are below 8 in terms of the reliability, because anything lower than that, they don't provide us with information that is any use to us. Okay. Validity refers to, does this test really measure what it says to measure? I think a great example of this being a problem was there was a test out there that was one of the most popular tests used in the country, and it had a test on, it was a cognitive test, and it had a test called arithmetic. Well, number one, my problem is, why would you have an arithmetic test on a cognitive test? Because arithmetic test is something that you learn in school, arithmetic skills. And so that should be in an achievement test. So having a skill or a school-based test and a cognitive assessment throws things off. So all cognitive assessments should only be those should only have tasks on those that we have not been exposed to or that we don't teach in school. So secondly, though, with what we finally discovered was that with the advent of new computer technologies, and this test had been around for years, when they did a thing called factor analysis, and I won't bore you with that, well, they found out this arithmetic test was not measuring arithmetic tech, it was measuring short-term memory, because the way it was set up was that you would, as the administrator, would give the youngster a word problem, and they had to respond. And what happened was that if you had short-term memory deficits, you did poorly on this test. If you had strong short-term memory, you did well on this test, and your math skills had nothing to do with your performance on this test. So that was an invalid test. it was named arithmetic, but it wasn't measuring that at all. Okay. Standard deviation. We're gonna talk about. We talked about that a bit already. It defines the average range, and so it's one standard deviation above the mean, one below. So it's usually for all the tests that you'll be using, it's going to be 15 points. Psychologists use ones that I said earlier at 10 points, but for the ones that you're going to be using are 15. Every time you move a standard deviation in one direction or another, you've either jumped over a lot of people, and that represents, I tell kids, that's your superpower. You've jumped over a lot of people. When you go in the other direction, that's the youngster's kryptonite. That every time you go a standard deviation below the mean, your skill deficit grows more significant. Okay, so it's a measure of relative standing. Where were you compared to everyone in the norm sample? Standard error measurement. This is very important, particularly I've seen this at the high school level become a problem when we're transitioning young adults to adult services, and I'm going to give it an example of where this becomes a problem. But what standard error measurement is, it's the error associated with a single score, and a good test, a well-developed test, will tell you what the standard error measurement is for every test that's within that test battery. And generally, it tends to be around 3, but it varies. And so we're going to see in a minute while this is important. In terms of reporting out results, remember sharing results in a report fashion and with parents, the state and federal regulations say that we need to consider the standard error measurement when reporting scores. And the reason for that is to communicate to parents that this is not Seiko timing from the Olympics. All these assessment things we're doing have error associated with them. And so we're going to see that there's kind of a band or an area in which we believe your son or daughter is functioning. And that's what we're going to address. And I'm going to show you how we need to say that to parents, as well as how we need to write it in our reports. And then lastly, as part of the psychometrics piece, we're going to look at the various kinds of scores, what they mean, and who we should be using them with, and when we should be using, and on the other side, when we should be avoiding them. Okay. So in terms of reliability, I just want to let you know they're out there, and you just feel comfortable. Yep. I just heard something? No comment? Am I still with us?
Yep, you're still there. I'm not sure what that was.
So this is kind of in the weeds. But just to let you know, they're aware of them. And we feel comfortable asking our contracted evaluators, and also feel comfortable getting into the manuals ourselves to see, okay, what is the reliability of this stuff that I've been using or that I plan to use? So the kinds of reliability you're going to see is test, retest. That's the best kind. And what's happened there is you've administered the test to someone, and then you come back within a week or so and re-administer it. And absent practice effects, those two scores should be fairly similar. As you might guess, that's the most expensive way, because when a test is being normed, they're paying people like me and you to do this testing. And now I've got to go back and do it a second time. Well, you got to pay me a second time. And we also pay our test subjects, get paid as well. I have 2 grandchildren who have a college fund set up. I've tested them so many times. It's part of norming. But anyway, so test, retest, that's the gold standard. There's a good chance, depending on the test, that it won't even be listed in the manual because it's expensive too. So there are certain test publishers who produce what I call quick and dirty tests, and you're not likely to have that. Okay, test, retest piece because of the expense. Alternate form means that, so for example, those of you familiar with the Woodcock-Johnson and also the Wechsler Individual Achievement Test, there's a Form A and there's a Form B. The items on the test are comparable. They're not the same, but they're comparable. And so what they do is they administer the test Form A to an individual, and then they do Form B, and they make sure that the two forms that come up with similar results, and that's alternate form reliability. So one of the values is we talked about validity of a test and some of the rooms we find ourselves in. Whenever I'm conducting the eval, I talk with the most important person in the building before I start, and that's the school secretary or administrative assistant. And I say, any drills going on today? Any fire drills? Any active shooter drills? I mean, there are so many drills we're doing. And if the answer is yes, I find out when that is, because I do not want my testing session interrupted by what that's going to invalidate some of the tests if I'm in the middle of the test. In the event that happens, and I'm not sure, when I have a test that has alternate forms, one of the beauties is I can grab that. Suppose I were administering one of the controlled learning tests and it got blown. And using Form A, I can grab the one out of Form B and still have reliable and valid results. Okay. Internal consistency, this is the one you're going to see the most. And this is the one where test developers are cheaters and dishonest. There's no other way to put it. So what they do is they'll take the test, and suppose it's a 100-item math test. They split it in half, odd numbers. So they administer all the test items to a group of people, and then they split it in half, odd items versus even items. And then they compare the results to see if they're the same. They do a correlational study. But the way they tweak this and they cheat is that, suppose I'm taking this test and I notice that I'm one of the test developers and the statisticians, and I notice that test item 2, number 4, the students always get right if they got number 2 right. So what I might do is move 4 to number 3. So now it ends up in the other test, if you know what I mean. And if we're both getting them right, that's going to increase. I know this is in the weeds, but that's going to increase my reliability. And so I'm manipulating the test items. And that's not beyond what test developers will do. So they manipulate the test items so that there's a high probability that you're going to get a higher correlation or positive relationship between the two parts. That's done electronically by computer program, costs nothing. So that's the one you're always going to see when you go into the manuals and look for reliability. You will always get internal consistency and perhaps nothing else. And then lastly, inter-rater or inter-score reliability. If the more complicated the test is, the more challenging it is. So as I mentioned earlier, I have a relationship with Riverside Publishing. On the upside, everything that they publish is really high quality. On the downside, much of it is very complicated to administer, which I'll let the cat out. The 5th version of all these tests is going to eliminate some of that complications, but which can result in inter-rater problems that I might score something wrong, or I might administer the test incorrectly and get different results. And so any of you folks, I know that there's at least one person out there on the line today who did some assessment work with me, and we spent a lot of time on some of these tricky tests and practicing the administration so we would get it right. So we want to reduce. Remember what we said? What's the greatest source of error or unreliability in assessment? It's you and me. So we need to, if we're using these tests that are a little complicated, we need to be sure that we're fluent in the administration of them. Okay, so again, to reiterate, for big decisions about our students, 0.9, if the data is going to go into with other pieces of data to make a decision, 0.8, and typically stay away from anything that's lower than 0.8. All right, validity. I'm not gonna spend a lot of time on this, but I just wanted to mention that it's out there. Face validity, does it look like what it's measured? If you got a math test, it's got math problems on it. Okay, content, does it contain all the important, so this is kind of important for test selection. Does it contain all the important aspects of the math? So for example, does it start off with number identification, then go to sequencing, and then go to addition, subtraction, for example, have all the content that you're looking for. Concurrent validity refers to, okay, if if I administer this math test, if I administer the key math, and then I administer the Woodcock-Johnson a calculation test, are those scores going to be similar? So if I have a good test that is reliable and valid, is another test that I'm choosing going to match that, which would suggest, and if it did, it suggests that test is reliable and valid too. Predictive validity. Does the test predict behavior? This is what the whole discrepancy model is based on, is does your cognitive score predict your achievement score? We've been believing that for over 50 years. We're moving away from that now. And so just as kind of a thought about why we're moving away, your cognitive abilities only predict 50% of your academic achievement. And if this was a group, I'd ask you to start yelling out right now, well, what's the other 50%? And I'm going to tell you instead, it's you, our teachers, our parents, our environment, our peers. All these other things go into the other 50% that results in our being successful in the academic arena or unsuccessful in the academic arena. And our cognitive abilities only account for half of that success, which is one of the reasons why we're moving away from the discrepancy model. And construct validity, is it measuring something that it's supposed to measure? So, and not something else. So that's what the example I gave you with that arithmetic test that we found was not measuring arithmetic test, but instead was measuring short-term memory. So in terms of validity, the take-home message for this is that it's the fact that the predictive validity of cognitive tests is so low is what has caused us to move. Even though we've been using it, depending on it for years, we're moving away from the discrepancy model. And then the other piece is content. Let's take a look at the test, and does it have all the aspects of the skill set that I want to administer? Does it have items that look at that? If not, I need to find a different test or add something to this test. Standard error measurement is associated with, it's the error. There's error in everything. If I were to give you folks a ruler that was a 12-inch ruler and ask you to measure a table that was 59 inches long, we are not all going to come up with 59 inches. There's going to be error anytime we measure something. And so we use this standard error measurement to construct what another confidence intervals, and you're familiar, I think you're familiar with those, or they're bands where we believe that the score truly falls. So we have an obtained score. So the obtained score is the score you got based on the number you got right on the test. So if it's we'll say it's a cognitive test, based on the number you got right, in this example here, you got an obtained score of 72, okay? But the computer program, most tests are scored these days by online computer programs. The computer program tells us that for this score, the standard error measurement is 3. Now, that's for this score. Some tests, and this is an indicator of the quality of the test, if you are using a test and in the manual, it tells you the standard error measurement for every aspect of that test is, we'll say 3, then that means they haven't gone to the trouble they're just giving you an average. A well-developed test will give you the standard error measure of every single score so that you can, because they change. And so in this case, the standard measurement was 3, the youngster got a 72. So the federal regs say that I have to report this when I report out the scores. So the way I do that is, and again, this folks might need this, didn't know this, but I just want to run through it. I got the obtained score, which is 72. So I add the confidence band and I subtract the confidence band. The standard error measurement, and that gives me this confidence band. So 72 minus 3 is a 69, and 72 plus 3 is a 75. I have to report to the parents these scores here, okay? And here's how we do that. Oh. Okay. I got ahead of myself, but we'll go here. So this is important in the case, and I see this quite a bit. And when we have youngsters who are transitioning from high school to adult services, and who have been receiving services throughout their school career as an individual who's affected by an intellectual disability. So our federal and state regs define an intellectual disability as performance on a cognitive score, which falls 1.5 standard deviations from the mean. And also says we have existing concurrently deficits in adaptive behavior. So you'd have to have adaptive behavior that fell 1.5 standard deviations below the mean. So whenever we're assessing someone and we think they might have an intellectual disability, we have to do both cognitive and adaptive behavior. So we said 1.5 we said the standard deviation is 15. So we said 1.5 standard deviations would be 22 points. So that means that to be eligible for special education in Vermont as a student, or in most states, as a student with an intellectual disability, you would have to have a cognitive score of 78 or lower. Now, one of the things that we're running into trouble with is that we've had high school youngster students who've been evaluated, and the evaluator might have used a tool known as the Woodcock-Johnson. And now it's time to start talking about transitioning to adult services. And we might have folk rehab at the table, we might have mental health, we might have whichever state agencies might be the most appropriate. And I've frequently heard representatives of these agencies say you need to do a Wechsler intelligence scale assessment before you transition, in order to be eligible. And when you ask why, they say, well, it's our regulations require it. So here's one of a piece of regulatory myths. So this is their the Department of Disabilities, Aging and Independent Living. These are their requirements. And it says, the most universally used standardized intelligence test for school-age children up to 16 is the Wechsler Intelligence Scale for Children, which is true. The most universally used measure for age 16 and over is the Wechsler Adult Scale, which is true. So for people with language, we have all this. A combination of assessment methods, just like we said for special ed, shall be used by the psychologist, shall use clinical judgment to determine the best tests to use for the individual. Diagnosis based on interpretation of test results take into account standard error measurement for the test used. Very important. This is in their regs. So this does not say that you have to use a Wechsler scale score. So if you have an active, a recent Woodcock-Johnson cognitive score that suggests the presence of an intellectual disability, that can be accepted by adult services. It does not, it only mentions in theirs that the Wechsler scale is the most commonly used, okay? Here's the other piece I want to point out. The interpretation of test results takes into account the standard error of measurement for the test used. So this is regulatory myth that may come up, and I don't know if anyone on our little training this morning has experienced this yet, but it may come up in the future. And so we need to stay on top of this, because it becomes an unnecessary activity for the student and sometimes the parents. Suppose it's really close to the youngster's graduation and there's no time for the school to do a Wechsler scale, even if they agreed to or thought they needed to. It becomes incumbent on the parent to find someone and hire someone and pay to do that. So, so the cognitive scores that we have higher reliability than the score, for example, should suffice. There's nothing in their regulations that would preclude that from happening. So, all right, we took a look at that. So, okay. Here's how we're going to say it in the report. L would obtain an adaptive behavior composite score of 72 during this administration of the Vineland behavior scale. Because there is error associated with all measurement, there is an 68% likelihood that his actual score falls within the range of 69 to 75. We could change that to cognitive performance. We could change it to mathematics, whatever it might be. But so that's that's what the state is looking for us when we report these results out, to recognize that these scores did not come down from the mountain inscribed on tablets of stone. There's error here. And where the 68 came from is right here. If you look on this little normal curve I have placed here. So in the normal curve, look at those numbers there. So that little squiggle number represents standard deviation or standard error measurement units. So if you'll notice, if you go up one standard error measurement, that's 34% of the population. If you go down one standard error measurement, that's 34. When you add those together, you get to 68. So because we've gone up one and down 1, 2, the psychometric way to state this is that there's a 68% likelihood. Now, no, I'm not going to say that. It's just going to muddy the water. So you can change that if you want to, but the rule of thumb is that you only go up one standard error measurement and down one standard error measurement. If you were to do it some other way, just about every person in the state would be eligible for special ed. So hopefully that makes sense to folks. I had another. Yeah.
There's a question. Jennifer asked, is there a time frame required by adult services for how recent the intelligence testing needs to be?
I have heard they want it within a year, that it needs to be within, which is reasonable. Yeah, so I think that's, I don't want to, that's what's come out in meetings that I've sat in, where they said, well, is it within a year old? We say, yeah, and they said, okay, we'll take it. Where it talks about the Department of Disabilities, Aging, and Independent Living, their regulations say we have to take into account the standard error measurement for the test to be used. Okay, so a slide I wanted to show you is not there, but I'll bring it up next time we get together. But here's what can happen sometimes. For adult services in Vermont, in order to receive services as a youngster with an intellectual disability, or a young adult or an adult with an intellectual disability, look what it says up here. You have to have a full scale score of 70 up in the top there. That's 2 standard deviations below the mean. So the situation arises sometimes where you might have a student who you've been serving as a student with an intellectual disability for many years. And now when it comes to adult services, that student might have a score of, we'll say 72. So adult services might say, well, that student's not, I'm not putting, I don't want to really speak for them, but I've seen this happen. This individual doesn't meet our requirements because they're above the 70 cutoff. And so their regulations also say that you have to consider the standard error of measurement. So this example here is considering the standard error measurement. So education regs say you have to consider it, and so do the adult services regs say it. Now, see that, rate that confidence band there, 69 to 75? The youngster, or this individual, this young adult, had an obtained score, cognitive score of 72. That allowed them to receive services in the general ed public school setting because they were 1.5 standard deviation below the mean. But that's not 2 standard, would need to be 7 to be 2 standard deviations below the mean. So someone might construe this as not being eligible. However, when you consider the standard error measurement, statistically, the probability of this young adult score being a 72 is equal to the probability of it being a 69, a 70, a 71, a 73, a 74, or a 75. Equal. So that means this youngster is eligible for, this young adult is eligible for adult services because when you consider the standard error measurement, the youngster has a score of a 69, which places them within the eligibility range. So hopefully that makes sense to folks. This is why these confidence bands are so important. Number one, we're required to report them when we report out results to parents and when we write our reports. And number two, in these situations where it gets like a fine line, this is not Olympic timing. Like I said, there's lots of error associated we do. It can result in whether or not you get services or not as you transition from school to adulthood. All right, so people okay with that? We looked at this already. So this is just the writing that you would, the narrative, and you can substitute any other test. I would obtain the general intellectual ability score, blah, 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 on the Woodcock-Johnson test of cognitive ability because of measure, and then there you are. Okay, how we doing? I think this is the most exciting part, but anyway, we'll see. So,
Rich, there's another question in the chat. Is the monitoring team asking for the standard error of measurement in our reports?
If they're not, they should be. It's part of, I don't know if they do. It's part of the regulations. It says that the teams, and so part of the writing is that educational planning teams are required to consider the standard error measurement. It's consider has been interpreted by the courts, and I got this from, I don't know if people remember Art Sinozia. He's a genius attorney, special ed attorney, a real child advocate. Anyway, the courts have interpreted the word consider to mean reporting it out and also as part of eligibility decisions. And so we need to let people know that's there. So I don't know how detailed the monitoring teams look at these things. My experience has been they spend a lot of time looking at dates. Did you get this done by a certain time? They're looking to see if we crossed our T's and dotted our I's, and that might be one of the T's and I's they're looking for. So I don't know the answer to that, but it can't hurt, since it's required by regulation, to make that a practice that we're all engaging in now. Okay, all right. We're going to close out the morning, but just by talking about the different kinds of scores that we're going to, and when they might be not such a good idea and when they might be okay. So standard scores, by standard, that means that they all have the same mean and standard deviation. So all the tests that you'll be administering as special educators are going to have a mean of 100 and a standard deviation of 15. And as I said earlier, those tests that are behavioral rating scales and tests that measure emotional and psychological functioning tend to have means of 50 and a standard deviation of 10. So it's incumbent upon us to explain that to parents. Percentile ranks, it's a relative standing. It tells you where the youngster is at this point in time and has no value, in my opinion, and I'll explain why. Other than that, it tells you when this test was administered, this youngster's performance was as good as or better than some percentage of the people who were in the norm sample. And I'll show you where that comes from. And the reason I want to show you where it comes from is will help you understand why it's such a problem. Okay. Z-scores, these are one of my favorite scores, but not people, but just to let you know what they are. They're standard deviation units. So a Z-score of 0 means that there's no standard deviation. So if the standard deviation of the test is 100, it means my score is 100. So if a Z-score is +1, it means I fell a standard deviation above the mean. And all the tests that we use has a standard deviation of 15. So +1 means 15 added to 100, I got a 115. Here's why I like Z-scores. Some of the tests that I use will print out a column for me that lists Z-scores. And some of these tests, you get 3 or 4 pages of numbers to sift through. I always go down the Z-score column, and anytime I see a plus, I kind of circle it with a green pen, and I see a minus, I circle with a red pen. And then I look at the number. If it's a +1, I'll put a plus next to it. That's a superpower because you're falling a standard deviation above. If it's a -1, I put a negative next to it, and that's something we need to address and as part of in our program and all that. So I like them because it's a quick way. So you'll probably never have to use them, but I wanted to list them. It's a quick way for me to scan a pretty busy computer printout of scores and quickly identify what are these youngsters, what's this youngster's strengths and challenges. Okay. T-scores, those are the ones that psychologists use. They have, it's a mean of 50, a standard deviation of 10. Skills, do I have some scale scores?
Track my progress.
What's that?
Track my progress uses scaled scores.
There you go. And so they tend to be developed by the own test developed. So for example, most scale scores, and this, you let me know if this is different from yours, Ms. Phillips. So if most scale scores are on a scale from 1 to 20 with a mean of 10 and a standard deviation of 3. Is that what you have on your Progress Smart? So it's a different setup?
Yeah.
Okay. So where you're going to see this is on the Wechsler scales. That's a test that I'm sure all of you are familiar with. A lot of psychologists use it. So it creates a problem because you have this big overall score. That's a standard score. So you have a score, we'll say that it will say is an 89. So you know the mean is 100 and the standard deviation is 15. So you know where it fits. But then you have a visual processing score of 7. It's out of whack with all the other scores that you're having. So you have to explain to folks that on this test, a 10 is an average score and a 7 is 3 points below. That's an area of concern that we might be looking at. And so that's what scale scores are. And with the exception of and I'm sure there are other exceptions as well, but most of the tests you're going to be exposed to, it's educational test. It's going to be a 1 to 20 scale, mean of 10, standard. And so when you get your report and it lists out scale scores, you'll be able to go through. And then we have developmental scores and age equivalent scores. And I was told by my lovely bride that I'm not allowed to use the language I like to use to explain these scores, except that do not use these scores. These are useless. These are useless scores, age and grade equivalent scores. And I'll tell you why. Oh, first, let me tell you a story. It's a good way to end this out with a fun story. So I had a contract with a district to come every other week and perform assessments, and they'd have a victim waiting for me when I got there. And so I arrived at this elementary school, 8 o'clock in the morning, checked in with the administrative assistant, and she said to me, the superintendent's office called, they need you to go to that office immediately. So for a psychologist, your stomach does a flip. What am I working into here? This had happened to me before, and it was like a student death, so it's just a terrible, horrible thing. So I get there, and the superintendent's there with the special ed director and a special educator, and they tell me, we have a due process hearing today at 12 o'clock, and we'd like you to be our expert witness. And I said, are you kidding? How can I be prepared? So anyway, they explained the situation to me. What it was a youngster whose parents unilaterally placed him in a private school. And now they were suing the school district to pay the tuition in the private school because the kid had only been there 3 months, but his reading had increased by a year just by being in 3 months, by being in this new school. So they were saying that's evidence that your school doesn't know what they're doing. This school does. We need you to pay. So I asked to see the evaluation that the school had done when they had administered this test called the Gray Oral Reading. And so I asked the special educator, had she administered that? She said she had. She showed me her results. Then I asked, do you have the manual for this test? We do. Get me the manual. So here it was. 10 minutes earlier, I was saying, no way. I opened the manual and I said, I'll do it. And here's why. So suppose I administer this key math test. And they're upwardly spiraling in difficulty. So those are the items, 1, 2, 3, 4, 5, 6, 7, 8, up to 18. And I administered to Joey and Billy. And so here's how Joey does. He gets the first 7 right, gets 1 wrong, gets the 9th one right, and gets the rest of them wrong, which is typical behavior we would expect given the upwardly spiraling difficulty. I administer it to Billy. He gets the first 2 right, gets the next one wrong, next one right, next one wrong, next one right, 2 wrong. He's got these splinter skills, gets that one right, gets 2 wrong. Look at this. He got number 12 right, which is hard, 14 right, 15. So age and grade equivalent scores, the way they're developed is they take the raw score you got, how many you got right, and they say, okay, what's the average grade equivalent of someone? What's the average grade someone in who got that same score? So in this case, the raw score was 8. And on this test, if you got 8 right, you got a grade equivalent score of 6.6. That's what Joey got. Billy got the same score, 6.6. Do these 2 kids have the same math skills? No way. No way. Now, I'm there the next week, and Elwood shows up. I administer him the test, and he gets 1 more right. And what's his grade equivalent? These are real, by the way. These are real scores from and so his grade equivalent is 7.6. And it went up by 1, by getting 1 more right, he went up by 1 grade. Well, guess what? That little story I was telling you, the same thing happened. When this private school administered the gray oral, that kid got 1 more item right. And then when you looked in the norms, it jumped them up a full grade. And who wants to guess how that due process hearing turned out? The school did not have to pay. They were manipulating the numbers to represent a year's growth, which did not occur. So aside from that experience, these scores are of no value, and really we should stay away from them. And as I said earlier, if you get a report from an evaluator and you have these age equivalent scores and grade, you have a youngster who's 8 or 10 years old, and you're being told they're functioning on the 3rd 3-year-old 6-month level. Well, this youngster's been on the planet. Oh, that can't be right. There's other things going on there. This youngster's been on the planet. They do not compare well or compare accurately with someone so low. Number one. Number two, the scores are just frivolous. So just as an aside, I told you I'm associated with a test publisher, and I asked a statistician, why the heck do you continue to include age and grade equivalent scores when it's contrary to everything else you're doing with this test? And they wouldn't answer me. And my assumption is that it's a marketing thing. People like these scores because they think they know what they mean, but they don't really mean anything. So let's stay away from those guys. Hopefully I haven't made anyone mad at me with this, but they really are not helpful. Okay. Too late in the day to calculate. So I want to talk about percentile ranks before we leave into it and why these can create problems. So don't get afraid by that box there. It's just, so this comes from a manual, and I just want to show you what happens. So what on the first column where it's just the scores that you can get. So I got a raw score of 44 right on this test. So there I am marked on the left-hand column. And so then I want to know how many people, this is how percentile ranks are calculated. I want to know how many people fell below me. So I go over there, see how I'm pointing that 54.7? That aligns with the 43. That's the score below me. So, and this is on the right, a cumulative percentage. It counts the people who fell below me. So 54.7% of the people below me did less well. So I did better than them. But if I look across here, see those numbers that say 4.3%? It says that, hey, you're not the only one, Rich, who got a score of 44. 4.3% of the people in the Norm sample also got a 44. So you don't own this score. You're sharing it with 4.2% or 4.3 of the population. So what they do is they give me half of that instead. What happens is the 54.7, that's the people below me, okay? And now the half of that 4.3 is 2.51. They add that to mine, and now I'm at the 57th percentile. So the way I say that represents how it's calculated. Elwood did as well as, or better than, so the as well as accounts for the 4.3 of the population I share this score with, or better than, that accounts for the 54.7% that I did better than. Okay, so I did as well as or better than 57% of the population. So I'm at the 57th percentile. Okay. And so this is how we would write that. Elwood performed as well as or better than 50% of the individuals who took this test. Now, here's where the problem arises. We should never use these scores to track progress. The only thing they're good for is to tell us where this youngster is at any given point in time. And I'll try to show you why. So this is the normal curve again. And so imagine, see how it has the hump in the middle and it's right at the mean? Well, the mean means that that's where most of the people are. So imagine that these are young people standing on each other's shoulders. And the taller it is, the more people there are in it. And so suppose I fall at the mean and I'm at the 50th percentile, okay? And now you administer, the next year you would administer this test. Now I'm at the mean, I'm at the 50th percentile. You administer this test and instead of getting a 100, I get a 102. And I move a little bit to the right of that line. Well, I have jumped over a whole bunch of people. So my percentile rank is going to go through the roof. Remember, because we're counting all the people who are below me. So even though I only made a little gain, rather than being at the 50th percentile, I might be at the 65th percentile or something like that. Just, do you understand what's happening there? So since we're all gathered here, a small gain in a percentile score at the mean results in a huge gain in your percentile rank. Now, conversely, the young people that we're concerned with oftentimes fall far to the left here, and there aren't many people down there. So I can make huge gains, but I don't jump over that many people because if they're all standing on shoulders, there aren't a lot of people there. So my percentile rank really doesn't go up because there's no one down there to pass. So it doesn't accurately represent the growth. So I could have made the same amount of growth as someone who was at the 50th percentile who had a huge gain in their percentile rank score. But because I'm down at this end, I've made the same amount of growth. I don't get a change in my percentile rank because there's no one to jump over. There aren't enough of us down there. Does that make sense to folks? So, in terms of scores, percentile ranks are good for letting us know right now, today, this is where the youngster's performing, and that's where it needs to end. We don't want to use these for measuring growth or progress or anything like that because they're not great measures, especially for folks who are following 1.5, 2 standard deviations below the mean. You're never going to see any documented growth based on percentile ranks. Or if you do, it's going to be minimal. It's going to be in the decimals. Okay. All right. During our next session, what I want to do is take a look at some commonly used tests and what they measure and how they measure and kind of get a start on the cross-battery approach to picking tests to match the responsibilities of the youngsters that we're interested in.